Today begins National Suicide Prevention Week, but supporting mental health is a year-round commitment for us here at CBS 8. We're working for you on this because you matter. All this week on the 4 and throughout the month, we will be sharing important resources that are available, and one of them is the National Alliance on Mental Illness. Joining me right now is Cathryn Nacario. She's the CEO of Nami, San Diego, and Imperial counties. Thank you for being here. It's great to see you.
Thank you so much. We are so thrilled to be here and just spread the word about how we can prevent more suicides in our communities.
Yeah, it's such a terrible topic, and it's hard for people to talk about, but creating more empathy and awareness is something that you do, we've worked on. How are we doing as a society in getting the message out there that there is help?
You know, we're doing well in getting the message out that it's okay to talk about mental health. However, unfortunately, our numbers for suicide are going in the wrong direction. We had a 3% increase nationwide between 2021 and 2022. A lot of that can be linked to because access to firearms is greater now than they ever have been, and it's correlated with more completed suicides. So we really want to emphasize that safe gun storage is really key to help prevent the fatal suicides that we're seeing, and to be able to talk to individuals of, if you see something is wrong with somebody, if you think somebody is in distress or is maybe just not quite being themselves, ask the question. San Diego County, through the Suicide Prevention Council, does a great training called QPR. Question, persuade, refer. And you are not going to plant the seed of somebody wanting to end their life by suicide just by asking them, hey, I notice things are a little different with you these days. Do you have a plan of harming yourself? And they may say yes. And often there's a sense of relief that, wow, somebody noticed that I'm going through something.
Yeah. You touched on the gun issue. Other than that, are there mental health specifics? Is there a COVID after effect? Are there other things like that that people are looking at that may have led to this increase?
Yes, so we're seeing higher rates of depression and anxiety just across the boards. Okay. You know, it's interesting. There's a little bit of an impact when a pandemic first starts to happen, such as major catastrophes. We see actually a decrease in suicide rates because the community really rallies together. But the longer something goes on, then we're finding where the rates actually increase, along with depression and anxiety. You know, cost of living is extremely high these days, and we're finding the highest rate in the category of completed suicides are individuals, older adults, over the age of 65. And a lot of that has to do with no longer being able to work, economic instability, but it is our fastest growing demographic for completed suicides. And
we've talked about increasing awareness, but that awareness isn't just for people to know the resources to help themselves. You touched on this, the question, the QPR, what is that again?
Question, persuade, refer.
And what are you doing to help people learn that? Are there ways that we can educate ourselves to look for people who are our friends and see if they're going through those difficult times?
There are a whole bunch of resources. If you get on the Suicide Prevention Council website here in San Diego County, also Nami San Diego's website, Nami National's website, nami.org, all have resources as to what to look for, how to communicate and open up that conversation that you may have with somebody that you may have a concern about. So we are here to spread the word, also to let you know that there are resources locally here. If you're just not feeling yourself and you're not quite sure where to go, call us at Nami San Diego, call our warm line. Cal Hope is another great resource here in our community, and it's staffed all by trained crisis counselors at Nami San Diego.
We're out of time, but I just want to touch on one thing once more. People, maybe an old stigma was that if you talk about suicide to somebody who's mentally ill, you're planting that thought in your mind. How strongly do you want to tell people that that's not the case, to reach out, talk to them?
That is a myth, 110% over. Never be afraid to ask the question. It's often when you don't ask the question that we can have a dire consequence. Somebody may be a little angry at you for a little while, may not be pleased that you asked, but you can live safely with yourself saying, you know, I did everything I could to try to prevent this.
Cathryn Nacario with Nami, San Diego, Imperial counties. Thank you so much for your time. As always, it's great to see you. Great resources out there. For more information, you can go to namisandiego.org for a complete resource guide. To see all of our stories on mental health, you can go to cbs8.com/youmatter. And if you or a loved one are in crisis, please call 988, the Suicide and Crisis Lifeline.